With COVID-19 restrictions easing in South Dakota, Sanford is updating its patient visitor policy. In tonight's Health Beat, KELOLAND's Sophie Heineman is finding out what patients can expect during their hospital stay.
In early March, Sanford Health announced a new visitor policy in an effort to limit the spread of COVID-19. The policy restricted all visitors to immediate family members only and allowed just one visitor per patient.
We really relied heavily on technology as well to help bridge that gap when possible, providing that connection through a phone call, FaceTime, and any way we could to facilitate communication with family.
With restrictions easing across KELOLAND, the hospital is following suit, allowing one support person per patient per day.
And we intentionally called that person a support person, knowing that in some ways people looked at a visitor as somebody else.
Essentially allowing not just family, but friends to now visit patients. And that support person can change each day.
One of the reasons we were able to allow a visitor or a support person on campus is because of the availability that we have of our surgical masks.
Visitors will be required to wear a mask, which Denovan says will be provided if a visitor is unable to attain one on their own. She says this policy also pertains to clinic visits.
I think it's especially important when there's a time where we are talking about maybe a diagnosis that's an unplanned diagnosis, that it's good to have somebody there with you for that emotional support.
It's only been a little over a week since the new policy went into place, and Denovan says over 100 support people have been visiting daily. With HealthBeat, I'm Sophie Heineman.
If you still have questions about whether you can visit a patient at Sanford Health, call beforehand.